Hello and welcome to our presentation. This is the presentation for the organization Salud de las Madres, which is in the Rio Grande Valley of Texas. This organization is created for the behavioral health care of mothers and families in the Rio Grande Valley who may be low income, non-English speaking, and underinsured or uninsured. This specifically is an organization that targets dealing with the impact of postpartum depression, but also works around other community and culturally important issues. This presentation was put together for you by Andrea Caicedo, Catherine Hernandez, Becky Sunquist, and Courtney Leduc. We hope you enjoy this presentation. The goal of this project was to first identify a gap in service and to create a call to action for the Rio Grande Valley community. So the gap we identified in service was for maternal mental health care and behavioral health care, specifically for low income, non-English speaking, underinsured or uninsured women and their families. The reason for this is that mothers and families in the Rio Grande Valley, especially low income and non-English speaking families, lack support and resources to seek out adequate maternal mental health care, especially as it pertains to postpartum depression, which this population happens to be an exceptionally high risk for. The reason why this is an issue for the whole community is that when mothers lack access to the care that they need, that impacts the health of them and their children, their infants, their families. The family dynamics become impacted, and it just extends out in a ripple effect from there. The whole community becomes impacted by this lack of support. The depression rates, as we just said, are significant in mothers, and this impacts families and communities at large. So by improving maternal mental health and well-being, we strengthen families' bonds. We contribute to the overall health and resiliency of the Rio Grande Valley community. I'm excited to share with you the beautiful mission and the beautiful vision of Salud de las Madres, which translated into English means the help of the mothers. The mission: SDLM is a compassionate, not-for-profit behavioral health care organization dedicated to empowering mothers and families in the Rio Grande Valley. We identify, meet, and advocate for mothers and families' needs, regardless of their ability to pay. We serve the community by providing comprehensive, family-centered counseling in a culturally inclusive environment. SDLM envisions a future where birthing children and motherhood are supported by balanced and abundant resources. We aim to achieve our vision by utilizing holistic and integrative approaches to behavioral health care, ensuring that every mother and family receives the care and support that they deserve. There are 6 really important values that we hold at SDLM. First and foremost is hope. Our aim is to instill hope in mothers and families, empowering them to overcome challenges and to build brighter futures. The second value is diversity. We celebrate the diversity of our whole community. We respect and embrace the cultural differences that make each of our community members unique. The third value is compassion. We approach our work with deep compassion. We provide care and support to mothers and families with empathy and understanding. The fourth value is acceptance. We aim to create an inclusive environment where every individual is accepted and valued for who they are. The next is advocacy. We advocate tirelessly on behalf of mothers and families, ensuring their voices are heard and that their needs are met. And finally, we prioritize family-centered care. We prioritize the well-being of families, recognizing that strong family bonds are essential for our healthy communities. We have a lot of great services at our agency. All the services start with an assessment to assess for depression in our clients. This is important also to direct therapy as the course of counseling progresses. We offer culturally adapted therapies, individual, group, and family therapy. This is offered by licensed counselors, licensed professional counselors, as well as graduate interns in the social work department, as well as the counseling program. And this is all overseen by counseling supervisors, as well as psychiatric supervisors. We have a social work team that works to connect our families with resources that they may need for day-to-day living. We also have a 24/7 warm line, which is not a crisis line, but a quick way for families to receive the resources that they need. We also have these wonderful peer support groups where graduates from our program can come back and lead just groups for mothers to make connections with other mothers in the area. And this way we assist in building community that's resilient. And then we have some additional support classes for our community. In recognition of the challenges faced by mothers who lack a support system, we offer groups and classes that are like budget conscious cooking classes, or a financial planning and budgeting class, education around what to do with your little ones, how to take care of your children, how to take care of multiple children. We provide incentives like children's books, essential baby and mom items, and gift cards that are donated from the community. We provide those as like incentives to get people to attend the classes. One final thing that we consider a peer support group, or we label it that to avoid any triggers, is we also have some services that support women who are enduring domestic violence. We know that mothers are more likely than other women to seek out care because they want to be a good mom and it's for the sake of their children. So it seems like SDLM is a naturally good fit to connect survivors of domestic violence with the care they need. We have partnerships with a lot of organizations in the community that also help support this. In terms of promoting social justice and eliminating oppression and discrimination, dismantling oppression and discrimination in the Rio Grande Valley means supporting Latina mothers to combat mental health stigma that's especially prevalent in communities of color. This was in both the Kaltman article from 2014 and the Ponting article. So our services involve education for our mothers and families, but also community outreach to sort of build awareness and build education within the community of how we can support and bond together as a unified community. We offer our peer support groups and our peer support classes, and we foster connections at every level of being to reduce isolation. So within the family, within the neighborhood, within the community, within like-minded or like-positioned people, like mothers to mothers, or maybe religious affiliation, or we try and just make as many connections as possible. Salud de los Madres operates as a nonprofit in the state of Texas. There are 9 steps that we follow to create our business entity. So number 1, we chose our name, Salud de las Madres. We chose incorporators and directors. The board of directors is the 4 of us: Andrea Caicedo, Courtney LeDuc, Catherine Hernandez, and Becky Sundquist. As the process progresses, a named director will be interviewed and hired to be the primary director responsible to the board of directors at SDLM. The 4 members of this group will serve as the board of directors, and 1 person will be determined to be the incorporator who will sign the articles of incorporation, who will not be the director at SDLM. The 3rd step is hiring and appointing a registered agent. The board of directors will determine whether the registered agent is a hired employee who maintains regular office hours and the running of the office. This could be the director, but it is advised that an additional employee is hired for this role. Primarily, the registered agent receives and handles the official correspondence on behalf of SDLM. The 4th step is filing for Texas Nonprofit Certificate of Formation. In order to be declared a nonprofit, SDLM will need to complete a certain form found on the Secretary of State website, and the application costs $25. Then we will create nonprofit bylaws. We create bylaws to determine how SDLM will operate. We decided to use the free Texas bylaws template, which can be found on the web. And then the 6th step is obtaining an employer identification number, an EIN, which we can get through the IRS. Then the 7th step is obtaining a business license. A general business license is not required in Texas, but we will also need our North American Industry Classification System code. And then once we have this, we can apply for a tax license. And finally, 2 more steps. We will file for tax exempt status. To be considered as a nonprofit, we have to file as a 501c4. A nonprofit status is the profit or designation for social welfare organizations. And then finally, we will file for Texas tax exemptions, which will enable our organization to be exempt from paying franchise and sales tax. So that's our exciting nonprofit business model. Our organization plans to obtain liability insurance through the University of Texas system. This is really exciting. In the Rio Grande Valley, the primary hospital and the primary teaching hospital for the medical programs is the University of Texas Health System. So we plan to affiliate with the UT Health RGV system in order to get our liability insurance. Our liability insurance can be found in the references under the University of Texas System 2005. So we plan to work with UT Health RGV teaching hospitals, medical, counseling, and social work professors and students. Supervision and consultation will take place with these professors. Even though we are a Chicago school group, we see how by working together with the school, the medical school and the counseling school and the social work school, it's just a benefit for the community. So the primary departments at UT Health that we will refer back and forth to are, of course, the OBGYN department for postpartum depression clients, and then also the psychiatry and the behavioral health departments within the University of Texas Health Rio Grande Valley system.
In working in tandem with the UT Health system, Salud de la Madre is aspired to acquire all of the credentialing with the same insurance providers that are accepted by the hospital. There's a very long, extensive list of insurance providers that are accepted by the UT Health system. So our organization feels that by employing the UT Health systems for like physicians and licensed professional, we'll be able to also instill their students and interns to be able to use the same insurance and go through the same insurance paneling and credentialing with all of our providers as well. We did list the website on our slide for the UT Health insurances that are accepted because it is a very long, extensive list. We would just need to submit an electronic application and have all the newly credentialed employees fingerprinted to be able to be added to the UT Health insurance, accepted insurance policies and plans. The procedure for behavioral health clinics receiving credentialing with Cigna in Texas has some very specific prerequisites. So we chose that as our example for a private insurance company that we would try to acquire. Through the Cigna website, their behavioral health network credentialing, they require that the clinic include 10 providers with one prescriber, one doctoral level provider who performs psychological testing, and at least 3 master level providers. All the clinicians must be state licensed to practice independently without restrictions or supervision. The clinic is responsible for cooperating with the credentialing process, including the utilization of the Council for Affordable Quality Healthcare, the CAQH. So we would fall into compliance for that behavioral health network credentialing on the Cigna website. The clinic must have a centralized intake and billing, must all be submitted under the clinic's name and tax ID. Once all of those requirements are met, then Salud de la Madre can fill out the online application off of the Cigna provider website under the name of Screening Application for Behavioral Health Clinics. And from there, we would be able to obtain credentialing. In the case of Medicaid, we would just need to apply for the new enrollment form. It's the Provider Enrollment and Management Systems, the PEMS. And once we submit all the information on the Medicaid site, they will review and essentially decide if we fall within their requirements. Because right now the UT Health system is taking Medicaid policies, we would assume that it would be easier for us to join in on that same system, as well as the UT health system so that we would be able to have our patients use Medicaid. Staff credentialing. All of Salud de las Madres service providers who perform services directly and any who are under contract with the organization will operate within the bounds of legal authorization as dictated by the federal, state, and local laws of Texas. Our providers will adhere to all of the terms of their licensure, certifications, and will comply with all the relevant laws and regulations in the state of Texas. Our providers will be required to have and possess and keep up to date with all of their licenses, certifications, and other credentialing documents. The providers that are included in the process of obtaining licenses will also need to follow state laws and supervision requirements. So those are like students trying to obtain like their master's degree or doctoral degrees. We are trying to meet the requirements of the state of Texas behavioral health authorities and accreditation standards that are required by the state through doing initial intake or assessments. And this will also include clinical, peer staff, and among other roles that will be completing those intakes and assessments. We will require a trained behavioral health care provider, either employed or available through formal arrangements to the UT Health system, who is medically trained and who can prescribe and manage medications. Salud de las Madres will also have staff either employed or available through formal arrangements who are credentialed and who have expertise in addressing and promoting the recovery of postpartum depression, domestic abuse, and among many other specialties that we will be providing services for. We did list the behavioral health providers that could be associated with Salud de las Madres, such as licensed professional counselors, supervisors, licensed independent clinical social workers, staff trained to provide case management, like case management employees, those who like run admissions and things like that, peer specialists, recovery coaches that we will have on staff to help in group settings and group sessions, and staff will be trained to provide family support as well. We at Salud de las Madres understand that we will be providing essential mental health care for women dealing with postpartum depression and also supporting their families. So we are committed to upholding the highest ethical standards in accordance to the American Counseling Association. The American Counseling Association established a code of ethics that gives guidance to mental health professionals on the ethical standards that must be followed in practice to ensure the safety and confidence of the provider and the client. The American Counseling Association states that a client has the right to confidentiality and must receive an explanation of its limits, access to their records, involvement in ongoing counseling plans, and the option to decline services or changes in modalities with the understanding of the consequences. We are very much in line with safeguarding our clients' privacy and confidentiality, which is why we chose that as one of our ethical standards that we want to address and uphold for our families. Our staff and providers will be receiving comprehensive training on how to handle our clients' information, such as their clinical notes and documentation, to ensure the protection of their privacy. Listed under the stipulations for confidentiality and privacy are the client to counselor confidentiality, legal and ethical expectations, the protection of their records, third-party disclosures, technology and social media, which is very big right now, and our professional responsibility to inform. To transition, the second ethical standard that we chose to highlight as a very big key point for Salud de las Madres is informed consent. Informed consent to us, well, not to us, but to also the American Counseling Association, is informed consent is a fundamental approach in which we recognize that our clients have the right to understand the nature of the services that they may be receiving and also the potential risk that may be coming from receiving those services, as well as benefits and other alternatives that may have options to. So our providers and staff will be trained to ensure that our clients are informed about their treatment options and actively participate in the decision-making process for treatment. That we feel will also increase the likelihood of a very strong counselor to client bond. Salud de las Madres will also provide staff and providers with detailed steps for obtaining informed consent, including ongoing documentation and communication with our clients to uphold each individual's autonomy and rights. So when we listed informed consent is as it relates to a counselor's qualification and rights and responsibilities, explanation of the counseling process, including the fees and financial policies, which we will discuss later on in our presentation, confidentiality and its limits, and as well as the scope of limitations for their treatment. They should be aware of the consequences of treatment and of not treatment and things like that. Third-party involvement, the use of technology in terms of our electronic medical record system, as well as our electronic health record system, and ongoing informed consent. So the consistency of getting informed consent and providing informed consents to our clients. In discussing ethical standards, Salud de las Madres prides itself on working with women and families who are working through troubled times. We consider that the families that might be referred to us may be from cases such as domestic violence, neglect, financial abuse. In working with these families, that means that they may be involved in the legal system or even court referred to our program. So we have placed a set of standards to provide the most legal and ethically sound treatment. The biggest impact court mandated treatment has on the therapeutic relationship is that most clients entering treatment that have been court mandated tend to lead to feelings of coercion, mistrust, and reduced satisfaction with treatment because they didn't voluntarily choose to join. So in working with court-referred cases, Salud de las Madres understands that court-mandated treatment requires a dual role from the therapeutic standpoint and the impact of the legal system on the voluntary care. So we want to ensure that our families connect with our therapeutic process through empowerment, structure, education, and providing a safe and understanding environment for them to succeed. We will provide training to our staff on how not only to maintain, but to also encourage feelings of empowerment, safety, and understanding for our core mandated clients. As we continue to discuss the privacy and security of our clients' information, our agency will set up our HIPAA and high-tech requirements. So this slide is in reference to our HIPAA and high-tech compliance. DeGroot 2023 states that HIPAA compliance rules address privacy, security, and breach of information. HIPAA laws are concerned with the protected health information, which is PHI, and electronic protected health information, which is EPHI. Businesses dealing with these two forms of federally protected information must have physical network and process security measures in place. So because we are not a standalone mental health practice, our HIPAA and high-tech requirement is more stringent. So at Salud de las Madres, we will use the privacy practice notice and security practice of the University of Texas Rio Grande Valley system. The privacy practice notice for UTC can be found on their website under Notice of UT Health Rio Grande Valley Privacy Practices. Our staff and our volunteers will all have significant training around handling our clients' information, as well as their clinical notes and documentation, and how to handle closure and appropriate disposal of those records so that clients' privacies are always maintained. In reference to high-tech, according to Senate Bill 1903, high-tech was largely designed for handling of medical records in the state of Texas. At least behavioral health care providers were specifically excluded from grants and fundings that was provisional for medical practices to upgrade their record keeping system. So we at Salud de las Madres understand that using electronic medical record systems is widely used and continues to increase in the medical and behavioral health setting. So we intend to follow all the best practices, including training on the acceptable uses of the electronic health record systems and electronic medical records technology. Our practice will be training our staff to use the principle of least privilege, which will limit staffs and partners to access clients' PHI on a needed basis. So, for example, there are systems that ding supervisors and management on when PHI is being used outside of the needed time. So if a patient doesn't have an appointment and they're going through their health records, there are systems in place to notify that so that we are aware of when PHI may be being accessed without the client's permission or for unneeded reasons. Finally, Salud de las Madres will participate in a biannual audit of HIPAA and high-tech compliance to maintain compliance, and will also monitor quarterly for opportunities to improve client privacy protection. So we'll continue to look into ways that we can improve on our privacy protection, because even if right now it works, it doesn't mean tomorrow it will continue to be successful. So we will continue to monitor that on a quarterly or biannual basis.
At Salud de las Madres, we want to ensure that our clients' and families' clinical and medical health information is kept safe and accessible. Record keeping plays a crucial role in maintaining and improving our treatment experiences with families, as mentioned by Dragan et al. 2010. The American Counseling Association, also known as ACA 2014, has set forth ethical guidelines that include considerations related to, but not limited to, record keeping. These ethical standards include confidentiality, informed consent, access to records, transparency, and record security. Record keeping allows for Salud de las Madres to maintain quality of care, ensure confidentiality, and allows for our providers to adhere to legal and ethical standards set forth by the ACA. At Salud de las Madres, we understand that proper record keeping can enhance the counselor and client relationship. SDLM, also known as Salud de las Madres, has chosen Salesforce as its customer relationship management, also known as CRM, platform. In using Salesforce, Salud de las Madres can monitor clients' progress, manage each client's treatment plan, provide consistency of care, etc. The Salesforce platform has provider's view and a client view that allows both parties to access the needed information during their time working with SDLM. In the client view in the Salesforce platform, it'll give clients access to their health information, allowing for communication between the client and the provider, and appointment scheduling. Equally vital is providing our staff and providers access to Salesforce at SDLM. On the provider's side of the system, our providers and staff will be able to manage patient information, appointments, and medical records. One of the main values held by Salud de las Madres is making care for maternal mental health more accessible for all mothers regardless of their ability to pay. One key means to expanding accessibility for our services is by accepting reimbursement from managed care providers. The only way to be reimbursed by insurance and managed care providers for mental health services is by first being paneled as an organization with managed care programs and adopting a medical model using diagnoses in order to code for billing and reimbursement. At this time, the only services that SDLM coordinates with third-party reimbursements are individual counseling and psychotherapy services for the perinatal onset conditions of depression and anxiety, which are coded within the DSM-5, American Psychiatric Association 2013. Other services offered at SDLM are not appropriate for reimbursement because they are community-based, wellness support-based, or run by persons not licensed, and therefore not appropriate for providers for insurance paneling. Additionally, the individual counseling services SDLM offers for clinical depression and anxiety are provided by licensed professionals paneled under the SDLM organization. All individual counseling services submitted for reimbursement must be pre-authorized in advance with the client's insurance company. Pre-authorization can be done by telephone, online, or by fax, as stated by Watson and Schmidt 2019. The intake staff or provider will submit pre-authorization through the Salesforce interface directly before beginning therapy sessions. We do want to note that the Salesforce interface will also be responsible for handling claims, denials, and the dispute of appeals process. This process is supported by the standardized intake procedures at SDLM, as well as our client record-keeping procedures. In the management of SDLM, a critical focus lies on the utilization of technology to enhance various aspects of operations. We want to emphasize the importance of our agency to ensure the highest standards of confidentiality and accessibility in alignment with HIPAA regulations and ethical standards. Technology will play an important role in our agency, enabling us to offer efficient and client-centered services. Our client portal, built on the Salesforce CRM platform, will not only streamline our communication between clients and providers, therefore increasing our accessibility, but it will also grant our clients easy access to their health information, scheduling, and much more. However, it is essential that we prioritize the security and confidentiality of data, adhering to ethical guidelines outlined by the American Counseling Association, ACA 2014. We do want to emphasize that counselors must adhere to legal regulations when managing records, and that communication must be made to the client about the specifics of record maintenance, encryption methods, security measures, etc., as stated in our ethical code, ACA 2014. Our agency is dedicated to safeguarding our clients' information. Additionally, we plan to take steps to assist clients who may not be familiar with technology being used, ensuring equitable access to our services. Technology will be instrumental in managing client information, appointments, medical records, and in facilitating telehealth integration for virtual sessions. It is important to adhere to our code of ethics when integrating technology into our practices. We know that during the informed consent and disclosure process, as mentioned in our ethical code, Section H, a client has the freedom and right to choose whether to use distance counseling and/or technology during their counseling process. As equally as important, technology used will be compliant with the Health Insurance and Portability and Accountability Act, HIPAA, to ensure our clients' privacy and confidentiality. HIPAA compliance is pertinent when handling our clients' data, and our commitment to ethical standards, particularly in terms of confidentiality, informed consent, will always remain important. The Board of Directors for Salud de las Madres determined that mental health counseling sessions with a therapist would be $50 a session. The board determined that this was a reasonable fee that gives our clients easy access to one-on-one counseling, but will further the sustainability of the organization. The fee can be paid for through insurance or third-party reimbursement. If the fee is a hardship, SDLM does not want financial difficulty to be a reason treatment is not accessible for our clients. Therefore, a sliding scale will be implemented in order to assist clients in the affordability of the counseling services. Additionally, SDLM will seek grant monies to provide scholarships to clients in need of services but are unable to pay the basic $50 fee. Along with the other programs we intend to offer, such as family classes and group counseling, securing grants and other fundraising avenues will be critical to the success of our work. Our budget will be reasonably low as we are using students and volunteers to complete the work of SDLM. Therefore, we can keep our basic counseling fee to a low $50, which is far lower than the average. SDLM will proceed to apply for grants with the University of Texas Health Foundation, partner with mental health advocacy groups, and seek other private funding opportunities available in the Rio Grande Valley.
Salud de las Madres is committed to a comprehensive community outreach strategy that's aimed at addressing the unique needs of mothers and families of the Rio Grande Valley in Texas. And so we hope to raise awareness about postpartum depression, or PPD. And we also hope to reduce the stigma that's associated with mental health issues. And so to achieve this, we plan to organize workshops and awareness programs in collaboration with local community centers. We want these workshops in different places in the community, at community centers, local schools, we want to be able to reach a broader audience. In addition, we plan to use bilingual materials to ensure inclusivity. And so these initiatives are designed to educate the community and recognizing PPD symptoms, as well as promoting, in general, mental health and wellness. We want our services to be accessible to our clients. And so in that way, we are striving in every avenue of communication, whether it's in person, whether it's our online materials, whether it's print materials, no matter what, we plan to use bilingual material and services so that all can be a part of the understanding proponent of who we are and what we do and how we can help. We are also working on transportation support so that we can assist others to come to our center, or we can come to them. And so that is part of our long-term goal, is to be able to erase transportation as an issue in receiving support. Also, we plan to use telebehavioral health so that others can more easily access us and our resources and our counselors. And so these are ways that we hope will be able to erase inaccessibility so that all are able to use our services. We plan to use community collaboration with local organizations to integrate education and mental health. One of those ways that we plan to do that is through just life skills, learning how to cook healthy meals on a budget, how to change a diaper, what are age-appropriate books and things like that for kids, what to do when you're stressed out and need a minute, but your children are crying. These are all life skills that we hope to be able to provide. We also want to provide community events that foster unity and support within the community, also creates awareness and does away with stigma. And we certainly want to build partnerships with our local healthcare providers, especially regarding maternal mental health care, so that we have that base of support for the medical needs that mothers and new families, young families will need. Finally, we have our online communication portion of our outreach initiatives. And this has become a necessity in our society today to utilize digital approaches. And it's really opens up an avenue for us to be able to share maternal mental health in a different forum. We can create online resources, healthcare partnerships, mobile counseling, workshops. All of these things can be done online. And so Salud de las Madres seeks to create that comprehensive and accessible community outreach program. And this hopefully will just eliminate barriers into receiving that care. So we continue to develop these aspects of our program. As a nonprofit whose sole purpose is to provide support and resources for the individuals and families, it is only reasonable that SDLM would be prepared as best as possible for crises and disasters that affect the Rio Grande Valley as a whole, whether those are natural disasters or man-made crises impacting the communities we serve. It is a good assumption that SDLM would be a part of the responsive efforts of those struggling with the effects of the crisis or disaster. As part of the mission of the nonprofit, SDLM connects clients with needed resources in the community and seeks to continuously be connected with organizations and businesses that can assist our clients with their needs. SDLM will be well connected with area organizations and advocacy groups in order to work together in times of crisis or disaster. Ideally, SDLM will be engaged in crisis management planning with the community so that there are plans in place should they need to be utilized. We will also communicate our plan to area public safety agencies to ensure that plans are effective and that we are included on the crisis response team. A crisis response directory will be maintained and regularly updated. And we are mindful that this is a time-consuming process as there are many situations and scenarios that need to be planned for, but it is important to bring effective recovery to those that we seek to serve. This will require training as well as preparedness on the part of our staff and a part of our communicating with that network of organizations. Salud de las Madres seeks a three-tiered approach to disaster and crisis response within the community. And these are suggestions that we are provided by FEMA, the Federal Emergency Management Association, through the Division of Homeland Security. Our first of the tier, SDLM, will assist community leaders with assessing needs immediately following a disaster or crisis. And it is important to know that needs must be addressed as a crisis is still unfolding. As our mission seeks to equip young families with resources following the birth of a baby, SDLM is in the unique place of offering necessary support to young families as a crisis occurs. From connecting families with food and supplies for infants and children to continuing care for postpartum mothers, our organization will assess and connect families with while attending to their most pressing needs in this first tier. This will include adding volunteers to our hotline crisis number, which is already operational 24/7. We know that adding volunteers may be difficult depending on the crisis or disaster, but we seek to secure a list of volunteers all over the Rio Grande Valley that are able to support that hotline. The second part of our tier is that we will provide a continuum of care following a disaster or community crisis. Oftentimes, care ends fairly quickly after a disastrous event, and people are left on their own to deal with ongoing issues pertaining to that critical situation. In addition, as people's lives are returning to some semblance of normal and or navigating what that new normal might be, balancing everyday issues with the issues following a crisis can be a difficult road. Mental and emotional issues following a traumatic event can have lasting effects on families and individuals' mental health. And so our nonprofit will provide necessary mental health first aid as needed for clients and other members of the community as the effects of the crisis continue to unfold. People all process events and situations differently, and we must remain vigilant and flexible to meet the needs of both our regular clients as well as additional members of the community needing extra support. Finally, SDLM will maintain a long-term support for individuals and families that require support well past the initial phases of recovery. In particular, the effects of post-traumatic stress disorder, or PTSD, are ongoing and need regular interventions to help people recover. It is important to note that this final phase of healing and recovery are often the most neglected by community response in crises. Therefore, SDLM will be an important voice in making sure that the coalition of community leaders responding to a crisis do so with long-term recovery in mind. And just on a final note with regard to crisis and disaster response, this type of care requires those in leadership roles to be flexible. As no two crises are alike, nuanced plans will need to be assessed and altered depending on the needs that arise in any given situation. SDLM will need to be vigilant and active, listening to clients and other members of the community so as to provide the best care that is needed. Additionally, depending on the crisis, SDLM may end up altering its mission and vision to the community following a disaster, should the needs be great enough. Effective service to mothers and families may take on a new version of itself as the need arises. It is important that SDLM engage in the plan put forth by community leadership so that we are working alongside each other and not in opposition. This kind of teamwork will create more trust within the community regarding SDLM and hopefully expand our reach in the long run. Most importantly, when the community leadership as a whole follows through with its own disaster crisis plan, a streamlined approach to recovery occurs instead of organizations responding in their own way and causing their own way and thus causing unnecessary barriers or sometimes repeated efforts. When it comes to crisis and trauma intervention, it is essential for any professional organization working in the field to be properly trained and educated on emergency response services and interventions. At SDLM, our staff will be trained on the effects of crisis and trauma across the lifespan. Our team will be trained on basic trauma and crisis responses such as acute stress reactions, like post-traumatic stress disorder, as well as complex trauma. SDLM will ensure our staff is educated in human development across the lifespan through previous education in graduate school and through monthly meetings to provide the most up-to-date training on development. We will ensure we evaluate our staff on their knowledge on common reactions, risk factors, age-related differences, different populations, and trauma-informed care. Our staff will be trained in acceptance and commitment therapy, or ACT, trauma-focused cognitive behavioral therapy, or TFCBT, narrative exposure therapy, NET, and mindful-based stress reduction, MBSR. These different forms of therapeutic interventions or treatment models will be based on assessment, needs, preferences, and the client's nature of trauma and crisis. We feel that it is critical to have a variety of interventions to provide our clients and families to make sure that our treatment is sensitive to the unique needs and experiences and to responses to trauma. At SDLM, we'll provide ongoing training for our staff on top of giving our staff resources to stay current with the best practices in the field. We want to safeguard an environment for empathy, support, and understanding because it is what will provide the most effective trauma and crisis intervention for clients. Providing administration, clinicians, trainers, volunteers, and staff with the latest theories and best practices will help prepare them with providing crisis intervention and trauma treatment for events like natural disasters, domestic violence, financial abuse, and so on. We will also collaborate with other mental health professionals, medical providers, and support networks in our area so that we can continue to provide families and clients with comprehensive trauma and crisis interventions. We know that collaboration with our local community will help us provide a well-rounded and comprehensive care for those we seek to help. At SDLM, we will make a crisis hotline available to our families and our clients, a mobile crisis team, a crisis telehealth service, and child and adolescent crisis services and peer support. We already are going to have our own crisis hotline to make sure that we can screen for suicide risk and identify strategies to improve referral follow-ups. The use of crisis hotlines at SDLM will allow clients and families to have 24/7 immediate support. We recognize the utilization of crisis hotlines is important to engaging our clients and families in suicide awareness and prevention efforts. Our mobile crisis team will consist of mental health professionals such as counselors and social workers who are trained and can respond to crisis situations in the community. Our telehealth crisis service will be a telehealth platform through Salesforce that can connect our clients who are in crisis to a mental health professional via video or phone call. These services are available to our clients of all ages and can be accessible to families that may not have the ability to travel to and from our facilities to connect to our team. The child and adolescent crisis services will be made available to children and adolescents who may be experiencing crisis related to trauma or family issues. This service will be provided by trained mental health counselors. Finally, SDLM will provide peer support services. These services will employ individuals who have lived experiences with postpartum depression, family trauma, abuse, to offer guidance and support to current clients and families going through difficult times. These peer support members will be well trained and provided resources, as well as offering help to give clients and families the best support. This service will be offered on an optional basis to ensure that we comply with HIPAA and ACA guidelines about informed consent. SDLM, as we offer behavioral health care services like individual therapy, group therapy, educational groups, and occasionally temporary child care. All of this is done in a standalone building. Our building has been created with the safety of clients and staff in mind. Entrance areas are behind glass. Service areas need to be escorted by a provider into therapy areas intended to be used. These are all physical barriers that have been intentionally put into place to provide for the safety of clients. Additionally, there is a there's a locked door back entrance that can only be exited from. It's locked from the outside. We know that things can escalate quite quickly for clients that are dealing with severe mental illness. And so we want to safeguard for them as well as others in the facility should the risks and agitation become intense. If there is severe weather or community disaster, plans need to be in place for the safety of clients, staff that are in the facility at that time. We have contracted with a software and communication platform called Everbridge that is an organization-wide communication platform that can be used in the event of a crisis. Everbridge provides text alerts, as well as software that supports emergency phone lines and real-time website updates, providing information on that emergency situation. Additionally, the plan in place is to reduce risk to the clients as well as to the staff. If a client is escalated in their situation, then the counselor's primary goal and responsibility is to try and de-escalate that client. If another staff person needs to be brought into the room, that can occur. Additionally, that other staff member can alert others to the escalated situation. In the event of an active shooter situation, the building will go on lockdown. If a severe weather or community emergency occurs, that will be assessed by management and staff, and shelter in place will be activated. The Everbridge platform has all the numbers of staff as well as local emergency numbers, law enforcement, firefighters, hospitals, and ambulance, and all of those organizations will be alerted to the emergency, whatever it is that is occurring. There is one final consideration in our emergency planning, is that sometimes crisis can happen in telebehavioral health situations. And it's important for providers, while they're conducting telehealth sessions for clients, to educate the clients on their informed consent and Counselors need to keep records that include the client's physical location, emergency numbers, the locations, nearby hospitals and police, emergency contacts, and support people should a crisis emerge while on telebehavioral health. These things are all according to procedures by the U.S. Department of Health and Human Services. Informed consent about all of these things must be given at the time of telebehavioral health sessions. Finally, SDLM prioritizes the safety and well-being of clients and staff and does so through training and emergency drills, and those are conducted quarterly. Ongoing discussions around risks as well as potential weather-related community emergencies, those are also dealt with regularly as well. Because Salud de las Madres provides comprehensive mental health care and wants to also provide important community support services to new mothers and their families, we want to bridge the gaps that we are experiencing for our clients in supporting basic domestic needs. The predominant client population at SDLM is low income, Spanish speaking, often first or second generation immigrant Latinas and their families. And so we want to partner, to collaborate with important organizations that are doing really good work, that together we can bridge some of those gaps. Our first is Friendship of Women. It is an organization, a nonprofit that has been in Texas since 1977. It helps clients and families that have been impacted by domestic violence. FOW has emergency shelters in which we can refer clients and their families. The shelters have access to food and clothes and crisis intervention, peer support groups, counseling, emergency transportation, and child services. And this is a really important aspect of the work we do as one of the primary reinforcements for women that are dealing with postpartum depression is because of domestic violence. And so this is an important collaboration. Our next organization that we are collaborating with is the Catholic Charities of the Rio Grande Valley. Catholic Charities aims to address immediate needs, particularly those related to mental health concerns. They offer pregnancy program counseling that is essential for supporting expecting mothers and families. And so sharing information on counseling services and material assistance and crisis pregnancy support will be an important collaboration with SDLM as we work together to assist mothers that are going through a mental health crisis prior to and following the birth. Also, Catholic Charities offers a financial assistance program, and we would like to collaborate with them on that to help our partner families get a leg up. We also want to engage in advocacy efforts in collaboration with Catholic Charities as they create public awareness campaigns, emphasizing the importance of mental health counseling services that both of us would operate or offer and collaborate on. We engage in community outreach programs with Catholic Charities, such as workshops, health fairs, and information sessions that will reinforce the collective impact on individuals facing barriers to mental health services. Our final organization that we want to collaborate with is Behavioral Health Advocates of Texas. It is a coalition of professional counselors organized around advocating for mental health policy in the Texas legislature. SDLM encourages all licensed professionals to become members of BHAT in order to support advocacy efforts of Latinx people and families in Texas, especially of the Rio Grande Valley. Since the Trump administration, protections for Latinx immigrants have all but disappeared, with deportations happening swiftly and without just legal process. Some important advocacy tasks SDLM will need to collaborate with BHAT toward is to demonstrate, lobby, and testify for greater immigrant rights, which we believe are human rights. SDLM and BHAT expect to collaborate on lobbying the local government to officially designate cities in the Rio Grande Valley as sanctuary cities where immigrant rights are supported and protected. SDLM seeks to partner with Behavioral Health Advocates of Texas in securing greater funding for uninsured women and children in terms of Medicaid provision for mental health care. These are all important issues where the gaps are quite wide for those that we seek to serve. And we do indeed want to create important relationships with those three organizations. In partnering with Friendship of Women, Catholic Charities of the Rio Grande Valley, Behavioral Health Advocates of Texas, it is important that this partnership with SDLM is visible within the community. Visibility will help in addressing barriers of stigma, poverty, and lack of educational opportunities. Partnership within the community can be in the form of free events, fairs and festivals, workshops, outreach opportunities that the community can be engaged in, and fundraising events. We can offer these services in our own facility, the offices and facilities of our advocacy partners, and in locations readily accessible to the clients we hope to assist. We believe very strongly that the mental health care professionals need to be about more than just counseling. Counselors often point to tools and resources that will improve a client's situation. Often, clients in lower income areas need more than a resource. Counselors need to walk alongside the client to take that first brave step into the unknown. That is advocacy. We need to provide educational opportunities, such as our free parenting classes, to grow knowledge and understanding about issues such as PPD, domestic violence, child development, and simply the basics of mental health. SDLM will also connect people with the resources that will help clients move past their current situation into a more holistic, life-affirming place for women dealing with PPD and their families through obtaining basic necessities. Whether there are legal issues that are bringing families down, or whether immediate needs like food and housing or our connections with FOW, Catholic Charities, and BHAT, we will be serving as advocates for our clients, serving as advocates of the social justice issues to the populations of people we are serving, and advocating for mental health in the Rio Grande Valley. In every avenue of assistance, our counsel social justice issues such as racism, gender equality, and poverty are addressed and brought into light. As more clients and families are assisted, and as deeper connections are made with partnering agencies, the wider the reach of this advocacy bridge, the narrower the gaps become. We want to say thank you for taking the time to listen to our presentation on our mental health agency, Salud de las Madres, and we are a center of hope for women and families in the Rio Grande Valley of Texas that are navigating postpartum stress disorder and all that comes with it. We hope this was helpful to you and enlightening, and more than anything, we hope it is inspiring as we seek to bring wholeness to the people of Texas. Thank you.